Vibrant Ladies in the Waiting Room with Christy.
Hello, you're most welcome to this show, Vibrant Ladies in the Waiting Room with Christy. My name is Christy Eman. You are most welcome again. And today's episode is titled Dental Care. And with me here is a very special guest who is going to cruise with me today. I'm not alone, of course. She's a medical doctor, a professional whom I deliberately invited to do justice to this topic, a dentist. Her name is Dr. Aishat Naboya. She's a passionate and dedicated healthcare professional with extensive experience in dentistry and patient care. Holding a Bachelor of Dental Surgery from the University of Benin, Aishat is currently serving as a senior resident doctor specializing in restorative dentistry at the Lagos State University Teaching Hospital. She is deeply committed to providing personalized care, assisting patients in their daily activities, and effectively communicating with patients and their families. In addition to her clinical role, Aisha holds the position of managing partner at Asthma Dental Clinic in Lagos, where she oversees operations and manages a team of healthcare professionals known for her leadership skills and dedication to patient care. She provides support and guidance to patients seeking dental care, ensuring they receive appropriate treatment and follow-up care. Aishat is admired for her compassion, empathy, and effective communication, making her a valuable team player willing to go to the extra mile to help colleagues and patients. Her attention to detail, problem-solving abilities, and adaptability further enhance her contribution to early healthcare setting. With a passion for providing essential care and assistance to those in need, Aisha is poised to continue making a positive impact in the healthcare industry. Meet Dr. Aishat Naboya. You're very welcome.
Thank you.
It's nice to have you here.
You too, thank you.
You look very ready to do justice to this topic.
We hope so.
Thank you so very much.
Thank you.
Thanks so graciously.
Yes, thank you.
It's a pleasure to have you here.
Thank you, ma'am.
And once again, you are most welcome.
Thank you.
So today we are discussing about dental care. Because so many people have been so careless in handling it. And I'm sure after this program, a lot of people will take conscious effort to specially give their teeth a very good treat. And so when you hear the word oral hygiene, what can you say about it?
Thank you for that question. Now, oral hygiene, just like the word oral, means that in our mouth, we have our teeth, our tongue, our gums. And just the way we take care of our body, we bathe our body, we make sure we smell nice. The same way we have to take care of our teeth, meaning that we have to brush twice daily, regularly. We have to floss our teeth, not use a toothpick on our teeth, and make sure that our mouth is as clean as possible. And just the way we see our doctor in the hospital, you try and see your dentist at least twice a year for a dental checkup to make sure that everything about your mouth is clean and it's healthy.
Wow. That's very interesting. So for those who don't know what it means to floss the teeth,
yes,
how can you explain that to them?
So thank you for that. A lot of people think that most times when we eat, we tend to get things stuck in our teeth, and
Yes.
it's natural. It's not a problem. But how you go about taking out the things that are stuck in your teeth is where the challenge comes in. And why we say the challenge comes in is most of us find ourselves doing things like, or we have to take a toothpick or something to
a lot
pick.
of people do that.
Now, those acts are very destructive to our teeth, and God did not design those kind of instruments to go into that place.
Wow.
What we call a dental floss or flossing is like a thread. But the thing about it, that how it's different from a thread is that it's wax, so that it doesn't injure our gums. So if you notice you're using a toothpick, most times you see blood at the end because you're not supposed to use a toothpick. You're supposed to use what we call a dental floss, go in between the teeth, and most of what is stuck there will come out. So you can find that as just a thread, or most times over the counter when we go to the big supermarkets, the pharmacies, it comes like a stick that has a thread with it. So it's designed that we use the part that has the thread and not the one that has the stick on it to actually pick at it, because we're actually destroying the gums that hold our teeth together. So it's better to use a dental floss. I hope I've been able to explain that.
Wow. I like that. Hello, viewers. I'm sure you are learning. And for those of you that have been using toothpick, I'm sure from today you will stop doing that. So, why the need for dental care?
Oh, like we say, the mouth is the gateway to the body, meaning that whatever is going to nourish our body has to go through our mouth. And if we know that the mouth is the gateway to the body, we have to keep it clean and healthy. It has to be very, very, it has to be optimal. At least when we say optimum, it has to be really clean so that we can, first of all, communicate. And how do we communicate? We talk. And when we talk, man is a social animal. And because man is a social animal, we have to talk to people. And in talking to people, you don't want to put people off by having bad breath.
Yes.
That's number one. And in having bad breath, as ladies, we have to make sure that the people next to us are seated comfortably and they don't have to shy away from you because of bad breath. And the second thing why you have to also take care of your dental health is, if you don't take care of your dental health, it will impact your work. Let me tell you how it will impact your work. One, you just take your teeth carelessly. You have what we call holes in the teeth. It leads to pain. And when it leads to pain, what happens? You have to take time off work. You have to now lose money that you would usually. So in doing that, you have to come to the dentist, now pay more money to have that checked out. But if you've already always put it first that, okay, I must take care of my teeth, and taking care of my teeth, I visit my dentist regularly, what happens is you find out that you are good to go and you have a beautiful smile. And it's said that a smile transmits 1,000 words, meaning that I might be burning now or might be squeezing our face, but the moment you smile, it melts a lot of people, it attracts people to you.
Definitely.
So you want to make sure that you, especially these days that we're very concerned about our appearance, our esteem, the way we carry ourselves. Of course, you want that the part that attracts people to you is in ideal conditions.
Wow. Thank you very much. That is quite explanatory.
Thank you.
I discovered that so many people can be very careless with the use of their teeth, such as bottle drink. I mean, a lot of people do that. Maybe they're in a hurry or they just feel that, why can't I use my teeth to open the bottle drink? And some will even use their teeth to cut thread and do all sorts with their teeth. I'm sure they really don't know the danger. So can you educate us on that?
Yes, we all do it. And man is designed for convenience. And because man is designed for convenience, whatever we see, our mouth is almost holding everything. They were biting our nails as a tailor. You are trying to put thread in your mouth, everything. But it's not right. These are what we call unhealthy habits and practices. What happens is the teeth is designed to grind food. It's designed to chew food. It's not designed for these practices. And it has a toll on your teeth, meaning that it will show the destruction that is happening. Let me give you an example. When you have a tailor that keeps putting a needle in her mouth, what happens is you start to see a gap that is not even even. It's not a fine gap that people like. So it starts to wear down their teeth. And that's not good. Now, you are trying every day, you are opening a bottle of drink. You don't find an opener and you use your teeth to open it. Now, our teeth, even if it's very strong, think of a mug, a glass. Now, you hit that glass on the wall. It might crack a little, but you can still use that glass. But keep hitting that glass continuously. What happens? The next thing you know, and we know we like beauty. Human beings are made to be beautiful. Now you now have a broken tooth. And now you are now scared. You are now panicking. Oh, I need to solve this. Especially if you're a public speaker, you're a pastor, you're someone that is just concerned about appearance. Now you have to now spend money. Prevention is better than cure. You now have to now spend money at the dentist, and it is not an emergency procedure. It is beauty. So because it's a beauty procedure, you spend more money, and at the end of the day, something that you could have prevented that God gave you, you will now lost it. Sometimes with that breaking off of the teeth or chipping off of the teeth, there's pain, and that's another problem again. So we would always advise that please don't do this, even if we try and say, oh, there's no opener, but please look for an opener, look for an alternate source to hold some of these things so that you don't damage your teeth.
What is the major cause of a missing teeth?
Right. Yes.
The missing teeth.
The major cause of a missing teeth is either it never came out at all, meaning that the way it was supposed to erupt or come out into the mouth, the tooth never came out, so it's still stuck inside there. That one is as a result of genetics.
Okay.
Now,
which is quite different from
yes,
damaged teeth.
So the other reason why you can have missing teeth again is you either were not taking care of your teeth very well, and we know that what carries our teeth is bone and gums. If you don't clean your teeth, you don't brush well, you don't take care of your oral hygiene, what happens is it begins to weaken the foundation of your teeth. One day you just bite into an apple, that will fall out. That's one. Another reason is a broken tooth. Either the teeth is weak naturally and you've done bad practices that will make the teeth go off, or you had a hole in your tooth and you went to a dentist and he pulled it off. So at the end of the day, you have a missing teeth. Now you have to replace that missing teeth because it is not what we call aesthetic or fine. So you now have to replace it. And there are two reasons why we have teeth in our mouth: for beauty, one, and the second one for function. Let me say function, chewing. So you now have to replace that teeth. And we know that the way God designed nature doesn't like vacuum. So if you do not replace that missing teeth, what happens is that other teeth start to rearrange themselves, and that's beginning disorganization of your teeth. Yes.
Really?
Yes. Now, a cause for broken tooth in life, we are going through age changes, meaning that the way you were when you were younger, it's not the same way we are now.
Of course.
Yes, so as we are going through that, the same way our body is going through changes, sometimes our teeth go through changes too. So if you are cracking turkey bone, cracking hard food, you keep doing that, with age, increasing age, what happens is that you start finding out that those teeth start to chip off. And because they start to chip off, that's the beginning of damaged teeth. That is another one. Another cause of damaged teeth is, like we said, when you don't take care of your teeth or you eat the wrong food, what happens is you have a hole in your tooth. When you have a hole in your tooth, it starts to cause damage to your teeth again, and that's another reason for broken tooth. Now, there are some people that the way they are born, the arrangement of their teeth is a bit more what we call procline, meaning that it's shooting out. We see those kind of people. Now, imagine that.
Can something be done about that?
Yes. So I want to explain that now. Imagine that person falls down and that tooth is not well placed naturally. What happens is an area of weakness. The individual falls down, and when the individual falls down, that tooth either breaks or completely comes out of the mouth. Now, for that kind of patient, we would advise that they come to see the dentist so that we can rearrange those teeth and it is properly arranged for them. And I'm sure you've heard of braces, so we use braces to correct that. Another thing that can happen is a lot of us we are getting more fit now, we are getting more aware.
Sorry, for those who don't know braces.
Okay. Braces is people that, I don't know if you've seen individuals with this metal thing in their mouth with a wire. You see some children, some young adults, you see this metallic appliance, we call it appliance, on their teeth. And like, what's that? What are they using it for? That's braces. It's to rearrange their teeth. And that's why we use them. So you see some people with these wires on their teeth, they're like, why do you have these wires? No, it's not for beauty and it's not for fashion. It's actually to correct the arrangement of their teeth. Now, like I said, people are getting more healthy this time. That means they are going to the gym more, they are doing more physical activities. if you are doing boxing, kickboxing, any of that, we advise that, or any of these contact sports, football, anything, wear what we call a mouth guard to guard your teeth, so that in case somebody hits you, somebody,
Wow,
yes,
that's a good one.
yes, it actually protects your teeth from damage. So it acts as a shock absorber. So instead of, it's rather that appliance that will fracture and not your teeth that will fracture. So I'm sure in the past we used to see it in boxers' mouth, but these days people that run on the treadmill that can easily fall, have face-to-face contact with people, contact sports, we advise them to wear this. In recent times, we're a bit more stressed. We are chasing money. We live in a big city. People are on the go. People are on the move. People's women are more in analytical. So, like I would always say, it's a woman's altar. And we are taking up more roles. We are taking up more opportunities. We are wives. We are mothers. We are also career women. And because we are going through some of this stress, most of the time we go to work, we are thinking. We come home, we are thinking. We are sleeping, we are thinking about what's going to happen to next day.
Exactly.
So what happens is sometimes we tend to grind our teeth while we are sleeping or when we are stressed, and we are not aware that we are grinding. Unconsciously, we are not aware that you are grinding. When the patient sits on my chair and is like, I didn't grind. Maybe ask my husband if I grind. Or and you have to now tell them that these are unconscious habits. So you're at work, you can't really express yourself. Somebody annoys you, you're clenching your teeth. You get home, your children are running up and down. You have to be a mother, you have to be a wife, you're clenching your teeth. Now, translate this also to the man. So we find out that people are having what we call, they're clenching and they're practicing a habit called bruxism, and they're grinding their teeth. And before you know it, they don't know. They might not even have holes, and they're like, I have a hole. It's not a hole. It's what they call, your teeth are grinding each other.
Wow.
So those are things that can cause damage to teeth, and they are all preventable and they are all treatable. So they can be, but it's always better that you prevent this damage.
Exactly, because a lot of time people actually wait.
Yes.
For a while, until things are out of order before they visit the hospital.
I think it's in Nigeria. It's a culture. It's a culture, and when we say it's a culture, is that now that we are creating more awareness and
exactly, and I think sometimes it's due to finance.
Yes,
people don't have enough fund for that.
Yes, but that's why they will say it's two peas in a pod. There are also people that have the resources now than they did not have before. And I've had a patient say, I went to Prayer City because of my teeth. Because he didn't like the way it looks, but now he has money, I can afford this. I want this.
Wow.
So people, even if they don't have that money, they want a change, and they would work towards it. And deliberately. And we are seeing adverts now. We are seeing the social media, everybody. There's awareness. So more people, but they might not just know. They might just not know, how do I go about it. And this is where we come in to give the dental education and tell them, this is what you need to do. This is what you need to do. You don't need to spend the big bucks. You just make sure that you take care of yourself.
Wow. Interesting. I like that. And talking about, are there particular food that help to strengthen the teeth or weaken the teeth? Can you tell us about those kinds of food?
Oh yes. So usually what strengthens the teeth is calcium, irons, and usually you get that in fruits, in vegetables. You get that in our normal everyday meals, balanced diets that you eat. But things that can damage our teeth, what we call refined carbohydrates. If I say refined carbohydrate, nobody will understand what I'm saying. But do you take sweets? Do you take biscuits? Yes. Are you eating chocolate? Yes. Those are all refined carbohydrates. So when you say, are you eating refined carbohydrates? You'll be like, no, I eat well. But are you taking Coke? Are you taking Fanta? How are you cleaning your teeth after you eat any of these things? These foods can cause damage to your teeth. And it's very important that you either not even consume them, and if you have to eat them, you have to make sure that you clean your teeth effectively after.
For somebody who doesn't know how to clean effectively, what do you tell the person?
So, first of all, what toothbrush are you using? Let's start with that. Are you using a hard toothbrush, or are you using a soft toothbrush, or are you using a medium toothbrush?
And what is the ideal brush?
Medium. Except for young, really young children, you have to use soft toothbrush. But it's medium strength toothbrush, not hard brush, not smoker's brush, because that's also destroying your teeth. Now, what is the force of how you brush? There are some people that believe that until they have scrubbed their teeth like it is a jean trouser, they have not cleaned their teeth. And those things are also wearing down your teeth. Now, how do you brush your teeth? So most of us are just going to check it. No, you have to open your mouth slightly and go down with your toothbrush rolling downwards. Meaning that if I do like this, I might not touch some of the teeth that I'm supposed to touch. But if I open slightly and I go one side to the other side like that, I'm properly brushing. When I come to where I chew, I now scrub around that place. That matters a lot. Then brushing twice daily is not just I brush it when I brush it. The ideal time to even brush is also very important. After breakfast. But you know, the way we were brought up as Africans, brush your teeth before you eat.
Exactly.
Yes. So at the end of the day, but what we want to do is we know that in our mouth is the food that we take and the bacteria is in our body. But it's how the bacteria operates that matters. Now the food is in our mouth. We want to reduce the amount of food that bacteria will see to act on. So if you brush after breakfast, there's not little or no remnants throughout the day, so your breath is fresh. Then last thing before you go to bed at night, you brush again when you know that you're not going to eat anything. So you're sleeping with no food in your mouth also, so bacteria has nothing to act on. And you wake up, you find out your breath is still fresher than if you just brush, then go and eat, then go and... Yes. So we would always advise to brush twice daily, a medium strength brush, and a fluoride containing toothpaste. It doesn't matter what toothpaste brand you are using. Could be Colgate, could be Pepsodent, anyone. Just make sure that you check the content and it shows that it contains fluoride. Fluoride is what strengthens and makes sure that our teeth doesn't develop holes in them. So that's my advice. Then you can mouthwashes, they are not necessary. They are not necessary. A simple warm water and salt will even go a long way than a mouthwash. But you know, because are you paying for warm water and salt? No, so humans will not value warm water and salt. They will value what they are paying for. Yes, but they forget that sometimes the active ingredient in some of these mouthwashes, they contain alcohol. And because they contain alcohol, it tends to dry the mouth. And when your mouth is dry, it can also precipitate bad breath. So you have to be careful how you use some of these mouthwashes.
Okay, and you didn't tell us about brushing how to wash the tongue too.
Yes.
It's important.
Very important. Very important. I'm stressing it. Very important. So there are some you can use your toothbrush, but there are some toothbrushes that come with the back that is rough, that acts as a tongue cleaner. So you use it to clean your tongue. Or some people buy what we call tongue scrapers that they use to scrape, but not too much force. It's just to clean the residues that are on your tongue. Because the tongue, you're actually right. If you leave it unclean, it actually causes serious bad breath. So you might need to clean, but you have to also be careful that you don't over scrape and now, because it means it's a flesh and it can easily bleed. And the tongue is responsible for taste. So if you injure it, it will alter your taste. So you don't want that too.
Thank you so much.
Thank you.
And is there any particular thing to do when you have a damaged tooth before visiting the doctor, the dentist? Is there anything to do, or just go ahead and visit them?
Okay.
Maybe it happened emergency or something like that.
So usually, what's the cause of the damage? Let's start there. So if it's as a result of a fall, like a household accident that happens, or a fall, or Okada hits you, or an accident, what we advise is treat symptomatically. So when if you are bleeding, quickly stop bleeding. If pain. You can take over-the-counter pain medications just to stop the pain before you come to the dentist. If you are bleeding and you feel some form of discomfort, in my opinion, I would advise that get warm water and salt. When we say warm water, not hot water, warm, a teaspoon of salt, use it to gargle very well, and come to the dental clinic as soon as you are able to. Don't delay, but please come. But treat as what, if there is no pain, there is a damage, don't do anything. But if there is pain, there is bleeding, there's some form of, please come in and use any of these things, then come into the dentist and let's have you checked out.
Thank you so very much.
Thank
I
you.
appreciate you. And yes, well, I like to smile when I take pictures. I smile a lot, and of course, it appears so beautiful because you smile. But there was this day I decided that I was not going to smile. That I would just, I'll take the picture without smiling. I found out that I didn't come out very fine. And another time, I did the same thing again. I didn't smile, and it didn't come out very fine. And people were like, Christy, it's better you smile when you snap, It appears very beautiful with your beautiful set of teeth. I remember a friend of mine who was courting this guy. And they were about to get married. They love each other. The guy loves her. She loves the guy. But there was this particular thing she didn't like about the guy. That was the teeth. There was one of his tooth that was damaged. And each time she sees him, it just upsets her. And she insisted that, I love you, I want to marry you. But go and change this particular tooth. No matter what it's going to cost you, please go and change it. And they went on. And the lady insisted. And eventually, the guy went to remove it and replace another one. And they eventually got married. They are married now. So, what is the paramount importance of tooth care, of dental care to ladies?
So it's within her. I love that kind of lady that insists on what she wants. It's very important. For ladies, we are naturally beautiful people, but we are made to enhance beauty. Meaning that's why the fashion industry is $1 billion industry. We are all about our appearance and how we appear. And it's the truth. How you appear is how you be addressed. So imagine I'm a dentist. I'm telling you, do your teeth, but my teeth is not in order. How does that bode well? How would that transmit to the patient? So for ladies, for us, we are made to, our self-esteem is based around how we look. The way we carry ourselves, the way so for me, you can't do all this makeup and your hair is like this one way. You can't wear this fine clothes and you're wearing, it's a total package. And it's very, very important. It's your beauty, it's yourself. And it's our partner, is what she wants. So for us, taking care of our breath, very important. I have patients that will come to me and say, I want you to arrange my teeth. I feel it's because of this, I'm not getting what I want. I'm not getting the job that I want. I'm not married. Or I feel, so it's something that bothers them. And if it's something that bothers, that's even as a woman, if it's something that bothers you, yes, they'll say, don't you, I do not do this, I don't believe in yourself. No, but you find out that when they solve that problem, they seem a lot happier. So, as women, we should take care of ourselves, and taking care of our teeth, that's one. Another thing is, we go through changes in life, from pregnancy to menopause. And when we go through these changes as adolescents, to when we become young mothers, to menopause, we are going through hormonal changes. As we are going through those hormonal changes, many things, the way they are changing our body, is happening in our mouth. We are seeing women that are pregnant with all their teeth shaken. They're having gum diseases. They're having many of these things. It is very important. And that's why now in some health insurance schemes, they are making sure that they put a dental plan for women. Because,
I like
yes, they are going through many issues that they might not even know, and they might be thinking, sharing this our clients where you think many things are spiritual, and it's not spiritual, it's hormonal. So they have to prioritize their oral health. Now, with certain diseases now, you can detect first from the mouth before even in your body. For example, diabetes. You can detect diabetes now from your mouth.
How?
Before they start, when you start having ulcers in your mouth, wounds that are not healing, your teeth are shaking. You ask, do you have diabetes? Do you have high blood sugar? They're like, no, I've never had it. Have you checked? So when they come to us and say, have you checked? By the time they go and check, it's true.
Wow.
We've also we've detected some form of cancers from the mouth, like leukemia. So it's very important that you must see your dentist. Some things that you might not pick up, we will pick it up because we know how it should look. So as ladies, it is very, very, very important for us to prioritize our oral health, not just for beauty, but for our overall health, so that we can take care of ourselves. And it's when we love ourselves and when we take care of ourselves, we can take care of the people around us.
Yes, absolutely. Because if we are not okay,
Yes.
there's no way
Yes.
we can take care of people
Yes,
around.
yes, and we absorb people's problems. So please, let's take care of ourselves first before, prioritize
Especially
self.
ladies.
Yes, very important.
Wow. Dr. Nabuta, it's been a wonderful time having you here.
No problem.
Thank you so kindly for the very powerful information. I have learned so much about dental care today.
Thank you.
Thank you.
Thank
God bless
you,
you.
ma.
And to the viewers out there, I'm sure you've been having a good time, learning so much about dental care, and you have learned so many things today, no doubt about it. And please be very deliberate and work on every information you heard today. And Dr. Naboya, what is your last word of advice to viewers?
Okay. Thank you for having me again. My last word of advice is one, please make dentist your friend and visit us regularly, at least twice a year, and follow the instructions and all the advice that we give, and just make sure that you keep your oral hygiene as clean as possible. Thank you.
Thank you so very much. Thank you very much. Yeah, viewers, do have a very wonderful time until next week. Same time and same station. God bless you. Bye-bye. Bye-bye.
For counseling, price, and sponsorship, contact 0803 112 2669 and 0809 424 2503.